Morning, everyone. Today I will be discussing the one of the masquerades in ocular oncology, that is PVRL. The title of my presentation is RP Undulations in PVRL Hidden Paradox. I have no financial disclosures. These are the abbreviations I have used in my presentation. PVRL is a rare but represents the most common form of intraocular lymphoma. It is mainly classified as diffuse large B cell lymphoma, and approximately 80% of the individuals with PVRL eventually develop CNS lymphoma, whereas 20% of the CNS lymphoma cases occur either concurrently or later involving the vitreoretinal counterpart. So the objective of my presentation is to determine the significance of three OCT biomarkers, primarily the RP undulations in PVRL, and evaluate the association of RP undulation, secondly the intraretinal infiltration, third the sub-RP or subretinal lesions with the severity indicators, which is first one is the partial regression, secondly subsequent CNS involvement, and third is intraocular recurrence. So it was a multi-centered retrospective study done over a period of 8 years at 3 centers, that is LV Prasad Eye Hospital, PGIMR Chandigarh, and the Mayo Clinic, USA. The inclusion criteria was patients having a biopsy confirmed cases of PVRL, age more than 18 years. The exclusion criteria was patients having media opacity, OCT signal strength of less than 7, and patients having OCT without baseline OCT at the time of presentation. The OCT signs that we have evaluated were, first, the primary one is the RP undulation. The second is the sub-RPE infiltration or the subretinal infiltration. The third one is the intraretinal infiltration. So these are the two primary cases, that representative cases. In the first one, we can see the characteristic leopard skin pattern, and now on the OCT we can see the characteristic subretinal and the sub-RP infiltration along with the intraretinal infiltration. The second case, however, highlights my primary indicator, that is the severe RP undulations along with the intraretinal infiltrations. The statistical analysis was done using Jamovi software version 2.53.0. The statistical initial association was assessed using chi-square test and student t-test, and then the association was estimated through the regression analysis, and a p-value of less than 0.05 was considered statistically significant. The primary outcome was the prevalence of RP undulation and its association with the severity indicators. The secondary outcome was the association of other OCT biomarkers with the severity indicators. These were the baseline characteristics. So our study included 134 eyes, biopsy confirmed eyes of 77 patients, in which 26 were the Asian population and 108 were the American population. And the RP undulation were present in 26% of the eyes, subretinal and sub-RP infiltration in the 50%, and intraretinal infiltration in 33.5% of the eyes. So the prevalence of the RP undulation in the Asian subset of the population was 62%. In American, however, it was present in the 15% of the population. The regression analysis, when we estimated the association with the severity indicator, so the first severity indicator, that is the partial regression versus the complete regression. Among that, RP undulation showed the significant association with the partial regression of the disease, having a p-value of 0.005 on the multivariate regression analysis, and with the area under the curve of 0.699 with the specificity of 83.8% and the sensitivity of 44.7%. The second association severity indicator, that is the development of the CNS lymphoma. So in that, intraretinal infiltration showed a significant association on the multivariate regression model with the p-value of 0.01 and with the EUC of 0.786 with a specificity of 92.5% and sensitivity of 36.4%. Now the third severity indicator, that is the intraocular recurrence. In that, however, none of the parameters showed any sort of association with the intraocular recurrence. So with this, we interpreted that the RP undulation were more prevalent in the Asian population than the Americans. It is associated with the partial regression of the disease. The subretinal and the sub-RP infiltration does not show any association, and the intraretinal infiltration shows association with the CNS involvement in the subsequent course of the disease. The limitation of the study was it was a retrospective design study. The subretinal and sub-RP infiltration should be treated as a separate variable, which was considered as a one variable in our study. And it included the different population in which the American Midwesterns would be different from the Eastern or the Western regions. And I would like to conclude my presentation with these 3 pointers, that the prevalence of RP undulation is higher in Asian population than in American population. And the key OCT biomarker, that is RP undulation, we were assessing in our study, is linked to the partial regression of the disease, suggesting that the disease is not limited to the retina or vitreous, as the name suggests, the primary vitreoretinal lymphoma. However, it extends to the choroid also. In addition, in our study, we found that the intraretinal infiltration is associated with the subsequent CNS involvement. Thank you for your patient listening.